Congratulations, mom-to-be. What an incredibly exciting time in your life. The first trimester includes weeks 1 through 13 of pregnancy and is the most crucial to your baby's development. During this period, your baby's body structure and organ systems develop. Your body also undergoes many major changes during this time, which we will discuss further into Module 1. You may also be flooded with many different emotions right now. The more you know about all that is to come, the more easily you can go through your pregnancy with confidence and hopefully experience a healthy journey for you and your baby. In this module, we will discuss the following topics and questions. What to expect after finding out you're pregnant, what to expect regarding prenatal care, how your body will change throughout the next few months, the important nutrients that you and your baby need during this time, what to look for in a prenatal vitamin, what foods and drinks to avoid during pregnancy, how much weight you should expect to gain during your pregnancy, and how much you should exercise while pregnant. What to expect after finding out you're pregnant. Pregnancy might leave you feeling delighted, anxious, exhilarated, and exhausted. All of these emotions may even be occurring at once. Even when you're excited about being pregnant, a new baby on the way can add a new element of stress to your life. It's natural to worry about your baby's health and your health during pregnancy, adjustments to parenthood, and the financial demands of raising a child. If you're a working mom, you might also worry about how to balance the demands of your family and your career. All of these feelings and questions are normal. It is very important to take care of yourself during this time and look to loved ones for understanding and encouragement. If you feel you're becoming overwhelmed or your mood changes become severe or intense, be sure to consult your healthcare provider. On top of all your thoughts, worries, and questions, your hormones are also on the rise, which can cause you to feel very emotional as well. When you first become pregnant, progesterone and estrogen, hormones that are part of your normal menstrual cycle, rise dramatically, and a new hormone called human chorionic gonadotropin, or HCG, begins to be produced. Progesterone is the hormone important for helping you become pregnant in the first place. It prepares your uterus lining for the egg to implant. It acts as a muscle relaxant, which prevents your uterus from contracting until the onset of labor. It is also associated with causing possible irritability, as some may experience as part of their premenstrual period. Because your progesterone levels stay elevated during your pregnancy, mood swings can be a possible side effect. Meanwhile, estrogen helps to regulate the increase in progesterone while also maintaining the endometrial lining that is vital for baby's development. Estrogen is believed to promote an increase in blood flow, which is also very important for nourishing baby. During pregnancy, your body increases the production of blood by approximately 50%. That increase in blood flow can also cause the side effect of breast tenderness and frequent urination, which will be discussed further along in this module. It can also lead to stuffy nose by causing the mucous membranes in your nasal passages to swell. Luckily, there is one reason we can be excited about the increase in estrogen during this time. The increased blood flow is what's responsible for your skin's healthy glow during pregnancy. Human chorionic gonadotropin, or HCG, is known as the pregnancy hormone because it's generally only produced during pregnancy. When you're pregnant, your levels of HCG will rise rapidly, doubling every few days before reaching their peak in the first 8 to 11 weeks. Home pregnancy tests show a positive result when they detect this hormone in your urine. This hormone is important because high levels of it indicate that the placenta is being created. Thyroid hormones also play a major role during this time. They are crucial for the normal development of your baby's brain and nervous system. During the first trimester, your baby depends on your supply of thyroid hormone, which comes through the placenta. At around 12 weeks, your baby's thyroid starts to work on its own, but it doesn't make enough thyroid hormone until 18 to 20 weeks of pregnancy. What can I expect regarding prenatal care? For most, the first sign of pregnancy is a missed period. It is important to then verify the positive test with either your family doctor, an obstetrician, nurse midwife, or other pregnancy specialist. They will help to guide you through your pregnancy. Your first visit will focus on assessing your overall health, identifying any risk factors, and determining your baby's gestational age. After the first visit, you'll probably be asked to schedule checkups every 4 weeks for the first 32 weeks of pregnancy. However, you may require more appointments depending on your health and medical history. It's important to attend each visit and never hesitate to reach out to your pregnancy healthcare provider with any questions you may have. There is no stupid question when it comes to the health of you and your baby. Your NutriVantage dietitians are also here to help you in any way they can along the way. How will my body change throughout these next few months? Tender breasts. As stated earlier, the rise in estrogen can cause blood flow to increase, which in turn can make your breasts tender and achy. The discomfort will likely decrease after the first few weeks as your body adjusts to the hormonal changes. Later in your third trimester of pregnancy, prolactin, the hormone that stimulates your breasts and causes milk glands to begin to grow in preparation for milk production, will begin to increase. This may cause your breasts to feel sore and tender once again. A few things to help relieve the discomfort. Wear a supportive bra. Opt for loose-fitting clothing. Try a cold compress. Take a warm shower. And ask your doctor for approved pain relief recommendations. Increase urination. As we discussed earlier, the increase in estrogen, progesterone, and HCG will cause an increase in blood flow. Now that your kidneys are working harder to process extra fluids, you will most likely feel the need to urinate more frequently. Pregnant women will also experience a physical compression of the bladder from the baby as it grows and changes positions in the womb. This causes the bladder to be able to hold less urine. Constipation. The same muscle relaxing properties in progesterone can also relax your intestines, slowing down your digestive tract and causing constipation. Iron supplements may also add to the problem. Further along in this module, we will be discussing the importance of prenatal vitamins and that they almost always include iron for good reason. We will further discuss the importance of iron during pregnancy in Module 2, the second trimester. Thankfully, there are many ways to prevent or relieve constipation. These include adding plenty of fiber to your diet, drinking plenty of fluids, and fitting in regular physical activity, which will be discussed later in this module. Hemorrhoids. Constipation combined with increased pressure on the rectum and perineum is the primary reason that women experience hemorrhoids during pregnancy. Hemorrhoids are varicose, swollen veins of the rectum that are usually painful. They often appear later in pregnancy but can happen at any time. Common signs of hemorrhoids are blood in the stool, blood on toilet paper, itching or pain in the anal canal, or a small swollen mound of skin protruding from the anus. These are external hemorrhoids. Nausea and vomiting. Morning sickness often begins 1 month after you become pregnant. It can happen any time of day. This may be due to the rising hormone levels. While there's no conclusive science on exactly what causes morning sickness, HCG is often thought to be one of the culprits. Since HCG peaks around 8 weeks to 11 weeks, some women begin to feel some relief once they begin their second trimester. Contact your healthcare provider if your nausea and vomiting are severe. To help relieve nausea, avoid foods or smells that make your nausea worse. Avoid having an empty stomach. Eat slowly and in small amounts every 1 to 2 hours. Eat plenty of carbohydrate-rich foods such as cereals, crackers, bread, rice, and fruit. They're easy to digest and provide energy. Avoid high-fat, greasy foods such as French fries and potato chips. Be sure to drink plenty of fluids. Drinking carbonated beverages can help, as well as peppermint, spearmint, and chamomile teas. Water is still the most important fluid to be drinking during pregnancy. Water carries nutrients from the food you eat to your baby. It can also help prevent some of the uncomfortable side effects of pregnancy that we have already discussed, such as constipation, hemorrhoids, and swelling. The Institute of Medicine recommends about 10 cups or 80 ounces of fluids per day during pregnancy. This is 2 cups more than the usual recommendation of 8 cups or 64 ounces per day. This goal should include mostly pure water. However, you can count juices, coffees, teas, and soft drinks towards your daily fluid needs. Keep in mind, juices and soft drinks can be high in sugar and should be limited as part of a healthy diet during pregnancy. Because of the potential effects on your developing baby, your healthcare provider might also recommend limiting the amount of caffeine in your diet to less than 200 milligrams per day during pregnancy. We will discuss this in greater detail as we move further along in this module. Fatigue. It's very common to feel tired and fatigued early in your pregnancy. It's a signal from your body to slow down and give it time to adjust to the incredible changes happening inside. Hormone changes play a big role in making you feel tired as well, especially the hormone progesterone. As we discussed earlier on, this hormone rises sharply during the first trimester. Thankfully, most women feel an increase in energy as they go into their second trimester of pregnancy. Try to get as much rest as you can. A healthy diet and exercise can help to increase your energy level, as we will discuss in the next section. Food cravings and aversions. When you're pregnant, you might become more sensitive to certain odors and your sense of taste might change. Like most other symptoms of pregnancy, food preferences can usually be chalked up to hormonal changes. How should my diet change during pregnancy? Good nutrition is key during pregnancy. If you are already eating a healthy, balanced diet, it's wonderful, and thankfully not too much will change for you right now. If you feel that your daily intake might be lacking, no problem. Let's discuss ways to be sure that you and baby are getting all of the right foods necessary during this time. In the first trimester, you should be eating about the same amount of calories that you always have. No need to increase just yet. We will discuss increasing calories in the upcoming modules. It is important that you eat a good balanced diet of the following foods in order to maintain good nutrition for you and your growing baby. Healthy carbohydrates. Aim to include unprocessed, low glycemic carbohydrates at each meal, such as healthy whole grains, oatmeal, and 100% whole wheat bread. Fruit, beans, legumes, yogurt, and milk are all good options. Protein. Be sure to include a variety of high-quality protein sources. Protein is especially important as protein needs increase with pregnancy. Preconception protein should account for about 20% of your daily calories. Make sure to eat 0.8 grams of protein per kilogram of your body weight, with a minimum of 40 grams of protein per day. For example, if you weigh 120 pounds, you should eat roughly 44 grams of protein per day. During pregnancy, you should get a minimum of 60 grams of protein per day, which will account for approximately 20 to 25% of your daily calorie intake. Healthy sources of protein include chicken, turkey, beef, lamb, fish, and other seafood, organ meats such as liver, eggs, yogurt, nuts, nut butter, beans, lentils, and legumes. During pregnancy, it is important to include different types of fat in your diet. The healthiest choices for fats are unsaturated fat. Unsaturated fats provide vital nutrients to help build and develop cells in both you and your baby's body. Polyunsaturated fats are rich in omega-3s, EPA, and DHA to help develop and sustain the health of your baby's heart, immune system, brain, eyes, and more. Sources of polyunsaturated fats include salmon, light tuna, herring, trout, walnuts, sunflower seeds, flaxseed, soybean, and safflower oil. Some monounsaturated fats include avocado, peanut butter, pumpkin and sesame seeds, almonds, hazelnuts and pecans, and olive oil, canola, and sunflower oils. We want to limit our intake of saturated fats. Fats from animal products are known as saturated fat. Be sure to include leaner and lower fat versions of these products such as skinless chicken, lean beef, or beef tenderloin. Lower fat cheeses such as mozzarella and provolone are also desirable. Low-fat milk and yogurt are packed with carbohydrates, protein, fat, and also contain calcium, which will be discussed further along in this module. Vegetables are also very important during pregnancy. Veggies are a very important source of vitamins, minerals, antioxidants, and fiber. They're also low in calories, so you can enjoy these in abundance while pregnant. Good sources of non-starchy vegetables include broccoli, cauliflower, Brussels sprouts, artichoke, asparagus, bell peppers, celery, garlic, spinach, green beans, tomatoes, mushrooms, okra, onions, radish, zucchini, beets, carrots, summer squash, and many more. Along with fruits and whole grains, veggies are a power-packed source of fiber, which can help maintain digestive health and help to prevent constipation, as previously discussed. What are the most important nutrients I need to be getting during the first trimester? There are many nutrients that are important for you and your baby during this time. The first three we will address in this module are folic acid, calcium, and vitamin D. Folic acid is a B vitamin. Our bodies use it to make new cells. During baby's early development, folic acid helps form the neural tubes. Folic acid is very important because it can help prevent some major birth defects of the baby's brain and spine, such as anencephaly and spina bifida. Center for Disease Control recommends that women of reproductive age who could become pregnant or who are already pregnant consume at least 400 micrograms of folate each day. It can be difficult to get 400 micrograms of folate through the diet alone. You can get 400 micrograms of folic acid each day by taking a vitamin with folic acid in it, eating fortified foods, or a combination of the two, in addition to consuming a well-balanced diet rich in folic acid. Folic acid can be found in fortified breads and pastas, wheat germ, eggs, beef liver, nuts, seeds, beans, and lentils. Many fruits and vegetables also contain folic acid, such as avocado, broccoli, Brussels sprouts, beets, asparagus, leafy greens, bananas, and citrus fruit. Calcium is another important nutrient of concern. Calcium ensures that your bones and mineral density are optimal and promotes the normal growth and development of your baby's bones, teeth, muscles, and nerves. It's also important for muscle contractions, blood clotting, and the regulation of blood pressure. If your intake of calcium is not sufficient, your body may leach calcium from your bones to ensure that your baby has enough. Aim to include good sources of calcium like low-fat dairy products, low-fat yogurt, milk, and cheese on a daily basis. Other sources of calcium include broccoli, tahini, beans, chickpeas, tofu, and canned fish such as sardines or canned salmon with the bones. The American College of Obstetricians and Gynecologists recommend that pregnant and breastfeeding moms ages 19 and over consume 1,000 milligrams of calcium per day. If you feel you are not reaching this amount through food, your doctor may recommend a calcium supplement as well. Next, we'll discuss vitamin D. Vitamin D now has extensive research supporting its role in immune function, healthy cell division, and alongside calcium, bone health. Vitamin D is necessary for the absorption and metabolism of calcium and phosphorus. Vitamin D is beneficial to your baby by supporting healthy bone development. Deficiencies in vitamin D is shown to be related to preeclampsia. Preeclampsia is a condition that occurs when there is a sudden rise in blood pressure and swelling during pregnancy. We'll touch on this further along in Module 3, the third trimester. Studies show that women taking 4,000 IU of vitamin D daily had the greatest benefits in preventing preterm labor and births and for preventing preterm infections. Vitamin D at this level is confirmed to be safe for you and your baby. Research from the Institute of Medicine now recommends this daily dosage of vitamin D for all pregnant women. It can be difficult to get 4,000 IU of vitamin D through food alone, so it may be important to take additional supplementation as needed. The foods containing the most abundant amounts of vitamin D are fortified milk, cow's milk, soy milk, almond and oat milk, fortified orange juice, fortified cereals, yogurt, cheese, eggs, pork, salmon, and mushrooms. Prenatal vitamins. What should I look for? Prenatal vitamins are supplements made for pregnant women to give their bodies the vitamins and minerals needed for a healthy pregnancy. Your doctor may suggest that you take them when you begin to plan for pregnancy as well as while you're pregnant. as we've already discussed, it is best to try to get specific nutrients through food. However, a prenatal vitamin and other vitamin supplements are great to fill in any nutritional gaps we might face. You may already be taking a prenatal vitamin. However, if you're not, please refer to the handout in this module titled Prenatal Vitamins for more information. Drinking alcohol, especially during the first 3 months of pregnancy, increases the risk of miscarriage, premature birth, and your baby having a low birth weight. Drinking at any point during your pregnancy is a risk factor for your baby developing fetal alcohol syndrome. The severity of the effects of fetal alcohol syndrome can vary, but the signs and symptoms can include physical defects, brain and central nervous system problems, as well as social and behavioral issues. The effects of fetal alcohol syndrome are irreversible. There is no known safe amount of alcohol to consume while you are pregnant. If you're having trouble avoiding alcohol, be sure to speak with your healthcare provider. Caffeine. As suggested earlier, because of the potential effects on your developing baby, it is recommended to limit the amount of caffeine you consume to less than 200 milligrams per day during pregnancy. This is about the amount in 1.5 cups or 12 ounces of coffee. If you're currently drinking more caffeine than this, it may be helpful to wean off 1 cup at a time or to slowly decrease to prevent headaches. Try sipping on another warm beverage instead, such as herbal tea or warm lemon water. Remember that other foods and beverages may contain caffeine as well, such as flavored coffee products, certain types of teas, soft drinks, energy drinks, chocolate, and chocolate-flavored items. Caffeine slightly increases your blood pressure and heart rate and may cause you to feel jittery, have indigestion, or have trouble sleeping. Until we know more about the effects of caffeine during pregnancy, it's important to stay within the recommended guidelines. Certain fish and seafood should be avoided during pregnancy. As mentioned before, some fish contain omega-3 fatty acids, which are beneficial to your baby's growth and development. However, we must be careful because some fish and shellfish contain dangerous levels of mercury. Too much mercury could harm your baby's developing nervous system. The bigger and older the fish, the more mercury it's likely to contain. During pregnancy, the Food and Drug Administration encourages you to avoid big eye tuna, king mackerel, marlin, orange roughy, swordfish, shark, and tilefish. Undercooked meat, poultry, and eggs should be avoided during pregnancy. You are at an increased risk of bacterial food poisoning during pregnancy. To prevent foodborne illness, be sure to fully cook all meats and poultry before eating. Use a meat thermometer to ensure proper internal temperature. Cook hot dogs and lunch meats until they're steaming hot. They can be a source of a rare but potentially serious foodborne illness known as listeria. Cook eggs and egg yolks until they are firm. Raw eggs can be contaminated with harmful bacteria. Also, avoid foods made with raw or partially cooked eggs, such as eggnog, raw batter, hollandaise sauce, and Caesar salad dressing. Unpasteurized foods should also be avoided during pregnancy. Avoid drinking unpasteurized milk and juices. Some soft cheeses such as brie, feta, and blue cheese are sometimes made with unpasteurized milk. Be sure they are clearly labeled as being pasteurized if you consume those items. Unwashed fruits and vegetables can also be a risk. To eliminate any harmful bacteria, thoroughly wash all fruits and vegetables. Artificial sweeteners. There has been some controversy and debate about the safety of artificial sweeteners, especially aspartame and saccharin, but most healthcare providers believe they're safe when used in moderation. Some recent research suggests that there may be potential side effects to consuming artificial sweeteners during pregnancy. One potential concern is that the exposure to the sweet taste of artificial sweeteners may increase the taste preference for sweet foods. It may have potential effects on blood sugar and the microbes in the gut. It could also have a potential impact on the thyroid hormones and impact a child's propensity for obesity later in life. How much weight should I expect to gain during pregnancy? The amount of weight you gain during pregnancy is important for the health of your pregnancy and the long-term health of you and your baby. There are possible risks associated with gaining too much or too little weight during your pregnancy. Gaining less than the recommended amount of weight during pregnancy is associated with delivering a baby who is too small. Low birth weight babies may have difficulty breastfeeding, may be at an increased risk of illness, and may experience developmental delays, such as not meeting the milestones for their age. Gaining more than the recommended amount of weight during pregnancy can increase your risk of having a baby who is born too large, which can lead to delivery complications, gestational diabetes, preeclampsia, cesarean delivery, and obesity during childhood. How much weight you should gain during your pregnancy is based on your body mass index, or BMI, before pregnancy.